Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Hi there, and welcome back to Plantar Plate Imaging. We're up to part 3, neuromas versus pseudoneuromas. Let's take a look at these lesser plantar plate pathologies. My name is Dr. Marlena Jabara, and I am an American board-certified radiologist specializing in musculoskeletal podiatric radiology. Let's take a look together. Our objectives will be to provide an overview of normal anatomy of the lesser plantar plate. Again, I'll review MR features of neuroma. We'll review Mulder's ultrasound maneuver to detect neuromas, and I'll discuss pseudoneuromas versus neuromas. Again, anatomic considerations in the classic crossover toe deformity are what we're trying to prevent. By using MRI for early diagnosis and accurate strategy, we can prevent these types of malalignments that occur secondary to plantar plate pathology. In this case, the second plantar plate has torn, creating a rotational malalignment where the second toe is now rotated over the great toe. This can cause a good amount of pressure deep to the skin surface and create ulcerations, which can be devastating in our diabetic foot population. In addition, forefoot biomechanics is at risk here, and we can see that we can have further complications upstream with our ankle, knee, hips, and spine. Again, looking at anatomic considerations, again, a review of our metatarsal region and the proximal phalanx, looking at the plantar plate, which is going to be the supporting fibrocartilaginous structure deep to the metatarsal phalangeal joint. That's going to be reinforced by the accessory collateral ligament and the proper collateral ligament. Furthermore, on medial or lateral aspects of the plantar plate, we are joined by the DTML, or the deep transverse metatarsal ligament. We can see all of this very well with transaxial imaging. Seen here in this illustration, we have our plantar plate, and that's joined by our accessory collateral ligament. We have the proper. On the medial border, we have additional reinforcements through the lumbrical. We also have our interosseous tendon, which will join the lumbrical distally, provide further capsular reinforcement. In addition, we have an interosseous tendon on the lateral aspects, and that further reinforces the lateral aspect of the capsule. Again, noting that neurovascular bundle at the plantar aspect or superficial to our DTML. We have our extensor tendons joined by our sagittal bands to the level of the collateral ligaments, and of course our flexor tendons joined to the plantar plate through the flexor tendon sheath. Joining our metatarsals together, we can understand metatarsal head purchase and forefoot biomechanics by looking at how metatarsal 2 to metatarsal 4 are related through our plantar plate complex through the deep transverse metatarsal ligament. Our plantar plate complex, of course, is further reinforced by the accessory collateral ligament and the proper collateral ligament. On the medial borders, we additionally have our interosseous anulumbrical along the lesser MTPs. And on the fibular side or the lateral side, we have reinforcements through our interosseous tendons. We can appreciate the paired extensor digitorum brevis and longus and the flexor digitorum brevis and longus and their flexor tendon sheaths. Looking at indirect signs of plantar plate, it's important to understand the concept of pseudoneuromas because it has been noted that pseudoneuroma sign, or the presence of having eccentric perineural fibrosis, was seen in the majority of patients that went to surgery for plantar plate tears. So you were more likely to have a surgically diagnosable plantar plate tear in the presence of having a pseudoneuroma. So we're going to be looking on MRI to be able to detect that sign so that we can furthermore see some of the harder to see plantar plate tears. But what we're essentially looking at is a region of eccentric perineural fibrosis seen here by these arrows that are detecting that the interneural changes have occurred closer to the plantar plate. and therefore the greater amount of pressure experienced on that portion of the nerve may be secondary to a malalignment based on plantar plate pathomechanics. So Morton's neuromas are neuromas that occur in the midline and felt to be compressed against the deep transverse intermetatarsal ligament at the level of the metatarsal heads. And we can differentiate that from a pseudoneuroma, which is felt to be eccentric perineal fibrosis closer to a plantar plate capsule. It's important to differentiate between neuromas, which are central, and eccentric pseudoneuromas because the treatment for plantar plate is very different from the treatment of Morton's neuroma, and we can improve patient outcomes with early, accurate diagnosis. So once again, if the enlargement of the perineal fibrosis is midline, that will be termed Morton's neuroma. If it's eccentric, it's more likely to be related to plantar capsulitis and plantar plate tears, and we'll call that pseudoneuroma. The diagnosis of Morton's neuroma is made identifying an oval mass with variable echogenicity, ranging from homogeneously anechoic to heterogeneously hypoechoic, associated with increased vascularity. We'll look to perform a sonographic Mulder sign, looking most commonly in the third metatarsal space between the third and fourth metatarsal heads, but also at the second intermetatarsal space, with the second most common. Of course, the differential diagnosis we're looking for is to differentiate a Morton's neuroma from intermetatarsal bursitis or even a plantar plate injury. Are you ready to take your podiatric imaging skills to new heights? Check us out at RadPodSquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.